Needle biopsy of lung nodules. What is a needle biopsy of lung nodules?
When a suspicious lung nodule is identified, typically on computed tomography, then a procedure known as CT-guided percutaneous biopsy of the lung can be performed. In those instances, a needle can be placed directly into and strategically into an area that is suspicious, and a piece of tissue can be obtained.
What are the risks of a needle biopsy of lung nodules?
Percutaneous needle biopsies are relatively safe. However, there are some complications that can occur with them. They can include bleeding or collapse of the lung, what we call a pneumothorax. It is rare that the pneumothorax or bleeding is serious, but that can happen. Most instances of these complications, however, are mild and can be easily tolerated by the patients.
How is a needle biopsy of lung nodules performed?
A CT-guided lung biopsy is performed with the patient lying on the table for the CT scan. The CT scan is again performed, but this time to specifically localize the area of abnormality. Typically, we choose a safe route for passage of the needle into the area of abnormality. It may not be the shortest route, but is the route that will allow us to get into that particular abnormality with the least likelihood of associated complications such as bleeding or collapse of the lung.
What will I experience during a needle biopsy of lung nodules?
Needle lung biopsies are performed with introduction of local anesthetic into the skin and deep soft tissues in order to numb those areas. After that, the needle is placed into the lesion, and the placement of the needle into the lesion in the lung is typically not felt. There are no nerve endings in that area.
What can I expect after a needle biopsy of lung nodules?
After a CT-guided biopsy of a lung nodule, you should feel a little bit of discomfort in the area where the needle was placed. This will take the form of a little bit of achiness. Other than that, you should not feel much else in pain. However, if after the procedure you develop any increasing shortness of breath or increasing chest pain, please notify your radiologist.
What are the benefits of a needle biopsy of lung nodules?
The benefits of needle lung biopsy are largely that of being able to establish a diagnosis with regard to whether or not a lung nodule could be malignant or not without having to make a large incision.
Can anyone get a needle biopsy of lung nodules?
It may not be possible to safely perform lung biopsies on everyone. Some patients have lung nodules that are too small to be safely biopsied. Others may have emphysema. If the emphysema is too extensive and surrounds the area of abnormality, then it may be extremely difficult to get into and get a piece of that abnormal lung without creating a large pneumothorax. If there are such issues, these will be discussed with you by your radiologist or treating physician.